In this video I'm going to talk about CBT, what it is, its uses and developments. As I'm not well equipped with technology, I'm to do this video in one take, and I've attached a PowerPoint presentation with images relevant to look at whilst listening to this video. I have also submitted a full script with a reference list. This video aims to teach you something new about CBT, however small, or just to gain a new understanding or perspective on how CBT works and is used. CBT stands for Cognitive Behavioural Therapy, but I'll be referring to it as CBT throughout. So CBT is defined by the National Health Service as a talking therapy that aims to change the way you think and behave. Cognitive behavioural therapy is the best known integration of models of cognitive therapy and behavioural therapy. CBT is a well-established way of dealing with panic disorder, OCD and psychosis, to name a few, as well as some physical health problems. CBT is a therapy that has developed through rigorous research and outcome studies. Behavioural therapy came first, based on principles of animal learning and the work of Pavlov in the early 1900s, as well as research into human anxiety by Watson and Rayner in 1920. Behavioural therapists began to get interested in a cognitive approach in the 1970s, and a collaboration of the two brought about CBT. Cognitive therapy seeks to change responsibility beliefs and appraisals, and thereby to reduce distress and eliminate neutralising responses, which usually occur as covert mental rituals. Similarly, Wells states that cognitive behavioural therapy aims to challenge the belief about hopelessness in clients. Integrated cognitive behavioural techniques can be used to regulate striatal function, effectively targeting the basal ganglia. Conventional traditional treatments such as taking medications or traditional therapies may not always work. Regarding this, CBT has an outstanding record of accomplishment and is the most common form of psychotherapy today. Cognitive therapy identifies certain thinking patterns and thoughts as central in the development and maintenance of problems. CBT is a broad movement that is still developing and full of controversies, as a complete definition of CBT can be difficult to comprehend. Kerwin, Palmer and Ruddle created a comprehensive list of characteristics on CBT, which I have put in the PowerPoint. The description of each characteristic aims to help a reader understand the components included in CBT, so it's useful for understanding multiple aspects of the movement. CBT originates from Dr. Aaron Beck's cognitive model, which was based on his experiences with depression patients. The cognitive model became popular in the 1960s. His model illustrates how emotional problems could be driven by patterns of negative thinking and proposed that problems could be alleviated by changing thinking processes. Since the 1970s, the cognitive model has been developed, refined and extended. The roles of physiology, behaviour, environment, motivation and process in therapy have all now been considered. The cognitive behavioural model incorporated the role of a person's behaviour in the development and maintenance of their problems. Beck states that depressive cognitions may be the primary cause of depression. CBT and antidepressants result in the most beneficial, effective treatment for depressive disorders. Beck argued that negative thinking is not simply a symptom of depression, but it's one of its primary maintaining factors. CBT is the most influential psychological treatment, according to Wilkinson et al. The efficacy of cognitive therapy for depression has shown immediate effects with long-term results. Beck states that early experiences shape how people perceive themselves and the world. These early experiences can affect aspects of the rest of your life. The term negative automatic thought, also known as NAT, is often used to describe the cognitive element of distress. This is what CBT aims to eliminate. The term was first described by Beck as a stream of negative meanings about what happens around or within us. Modern CBT has two main influences: behavioural therapy, as developed by Wolpe and others in the 1950s and 60s, and second, the cognitive therapy approach developed by Beck, beginning in the 60s but becoming far more influential in the 70s with the cognitive revolution. As previously stated, Dr. Aaron Beck is the theorist most known for the developments towards CBT, as the therapy is essentially a result of developing his cognitive model. CBT is the dominant perspective in today's psychology, and it's popular in self-help literature. CBT is subject to more research than any other of the psychological models, ensuring its reliability and constantly finding ways to improve. The level of patient satisfaction with behavioural treatment is high. Patients who have CBT treatment go on to have 1/3 to 1/2 fewer consultations in the year following initial treatment. In a randomised clinical trial comparing CBT, applied relaxation and waitlist control, a sample of 65 adults with a diagnosis of generalised anxiety disorder were observed. This experiment was repeated to contradict any reliability concerns. Dugas et al. Reported the results of the controlled trial, which show CBT was significantly superior to a waiting list control group, therefore showing CBT regularly has beneficial effects on clients. Schwartz proposed a cognitive behavioural self-treatment for OCD, which integrates the results of neuroimaging research into the cognitive approach. Schwartz found that clients with OCD respond positively to exposure and response prevention methods, in which clients are exposed to a stimuli that intensifies obsessive thoughts and then learn to resist the compulsive urges. Schwartz developed this method of cognitive behavioural therapy so that clients can treat themselves and essentially become their own therapist. In a 1997 Harvard study, it was found the majority of Americans preferred alternative and complementary methods over traditional psychotherapy or drugs. CBT, therefore, is popular for this reason as a modern alternative to drugs alone or traditional treatments. Rudd et al. Found that each study regarding deliberate self-harm that recorded positive findings employed some form or element of CBT, and each included some form of problem-solving component as a key feature. Results show that there are positive correlations between dialectic therapy and a reduction in suicidal intent. The cognitive approach encourages a collaborative relationship between a therapist and a client, in which they approach problems using collaborative empiricism. Dobson and later Holland and Beck studied cognitive therapy with the outcome that it is indeed effective. Evans et al. Found that in the long term, cognitive therapies are more effective than drug therapies. One of the first CBT techniques, named self-instructional training, or SIT, was developed by Mitchenbaum. There was a focus on thought processes and how these affect behaviours, with the aim of allowing clients to control their thoughts in such a way as to improve their performance and decrease distress. Mitchenbaum's theory works on the idea of attentional internal dialogues that can be trained to the benefit of the client. There is also the Socratic method to CBT. In this method, a client answers Socratic questions, which are questions that the client has the ability to answer but does not realise it at first. The Socratic method aims to direct clients' attention to possibilities that had previously been outside of their attention. Using this, the therapist aims to reflect on dilemmas to help clients achieve a new, more positive perspective. The Socratic question is the single type of question most strongly associated with CBT. The Socratic method derives from Socrates, a philosopher living around 400 BC, although theorists such as Padesky more contemporarily use this approach in CBT. There are many theories to support the use of CBT. However, as with any theory or model, there are criticisms and theorists who disagree with CBT. Skinner criticised CBT for being unscientific mentalism. Skinner has a theory of depression as an interruption of established sequences of health behaviour positively reinforced by the social environment. Skinner believed in behavioural therapies that focus attention on increasing access to pleasant events and positive reinforcers. Therefore, it is evident why he criticised CBT, because he aims to be more scientific in his theory. Additionally, psychodynamically orientated theorists disagree with cognitive behavioural approaches because psychodynamic theories originate from Freudian ideas, and CBT does not conform with their psychodynamic approach for these ideas. CBT has been developed so much over the years that it is now used to treat multiple disorders and issues. Firstly, CBT can be used in the treatment of eating disorders. CBT, with regard to eating disorders, has been observed as effective as it shows more intense and longer successful weight loss or maintenance. When treating anorexia, a therapist-client relationship can be very difficult. Trust must be gained, as well as a sense of collaboration. Weight restoration assisted by CBT can be useful in this context. It allows inpatients to gradually take back control over what they eat, therefore providing a safe collaborative resolution. Additionally, CBT is abundantly used in the treatment of obsessive-compulsive disorder. Special cognitive behavioural techniques improved the prognosis of OCD continuously. Research by Schwartz has showed that behavioural therapy, especially exposure with the response prevention and selective serotonin reuptake inhibitors, reduce obsessive-compulsive symptoms. Cognitive therapy is thought to work by altering both strongly held beliefs associated with OCD symptoms and interpretations of intrusive mental experiences. The cognitive behavioural therapy of OCD proposes that obsessional thoughts and normal intrusive thoughts do not in themselves differ. Obsessional problems occur when intrusive cognitions are interpreted as an indication that the person may or may become responsible for harm or its prevention. CBT was originally developed by Beck with regard to depression, and it is still used as a treatment for depressive disorders today. It is perhaps the most known way to treat depression along with antidepressant drugs. CBT works on depression by training oneself to resist negative thoughts and adopt a more positive perspective. Acting against negative cognitions and learning to disregard them will help a client to gain a more positive attitude, therefore decreasing depressive tendencies. Furthermore, a list of mental health problems that CBT can be used for is extensive. As CBT is relatively flexible therapy, it can be adapted and can effectively treat anxiety and panic attacks, bipolar disorder, borderline personality disorder, phobias, post-traumatic stress disorder, psychosis and schizophrenia, in addition to the aforementioned. The National Institute for Health and Care Excellence particularly recommends CBT for depression and anxiety, although there are also formal adaptations for anger problems, specifically phobias, eating disorders, PTSD and OCD. CBT is also offered for anger problems, drug or alcohol problems, sexual and relationship problems and insomnia. CBT can also help you find new ways to cope with physical health problems such as chronic fatigue syndrome, chronic pain, bad habits such as tics, or general health problems. CBT is often combined with drugs, especially in the case of depression where antidepressants are usually taken, to maximise the effects of the treatment to benefit the client as much as possible. Cognitive behavioural therapy was originally developed in relation to depression. It can now be applied to a wide range of psychological problems that range from depressive disorders to physical issues. CBT has become more developed by years of research and can now be used for phobias using safe exposure. There is growing evidence for the cognitive approach with different forms of psychopathology. There is no one model or pathology that can give us a full understanding of how it develops or how it should be treated. Due to criticism, many researchers and clinicians have begun to propose modified approaches to CBT that are based on the latest research, psychotherapy and psychopathology. Dialectical behaviour therapy, or DBT, for borderline personality disorder is an example of one of these empirically supported next-generation CBT approaches. These third-wave approaches attempt to balance acceptance and change-based strategies. Hayes named them third wave, as all approaches can be seen as linked to the classic behavioural therapy movement of the 50s and 60s. As discussed, developments in CBT are always being made. CBIT is another one of these advancements. CBIT is based on CBT in the sense that it's a structured but flexible way of addressing problematic clients. It is an established therapy that teaches people to change their behaviour over time. CBT has been successful on children and adults with Tourette's to reduce tics. In addition, computerized CBT, known as CCBT, is when CBT is delivered using a computer. This type of CBT can be in addition or instead of sessions with a therapist. CCBT is not recommended for individuals with more severe symptoms of anxiety and depression, as more intensive treatment and support is usually needed from healthcare professionals. However, CCBT can be useful for those who have had CBT sessions before and need to continue, although not so intensively. CCBT comes in packages, and a few of the packages currently available include Fear Fighter for panic or phobia and OC Fighter for OCD. The future of CBT is predictably diverse and will lead to more advancement and ways of treating problems. Component analysis of CBT will continue, and this will likely lead to a refined understanding of the most essential and effective strategies contained in the approach. Furthermore, a 2006 clinical trial indicated that behavioural activation was more effective than CBT, but only for severely depressed patients. Thus, in addition to finding effective components of CBT and developing them, contradictions can also be found that prove additional ways of working. More attention is being paid to basic research on psychopathology, and this is leading to modifications in traditional CBT approaches. For example, Clark et al. Tested a modified form of CBT that targeted self-focused attention in patients with social phobia based on emerging research on the key cognitive processes related to the disorder. They found the modified CBT approach to be superior to the traditional one. Additionally, researchers such as Barlow et al. Are developing new CBT interventions that focus on the core principles found to be effective across different psychiatric conditions, making them useful for patients with various emotional disorders. However, approaches like this are still in their infancy, and their success remains to be an open empirical question. Finally, approaches such as ACT and DBT are becoming empirically supported alternatives to traditional CBT, and this is changing the landscape of psychotherapy. As their popularity increases, only further research will confirm their viability and confirm their impact on the field. Finally, CBT is constantly developing, but there are always ways of improving a theory or model. Cognitive behavioural therapy could be developed further by its constant component research and analysis. CBT continues to be a popular and widely appraised therapy. Research continues on the area, which strengthens its popularity and validity, and also allows it to be used in new ways for different distresses. Cognitive behavioural therapy has constantly gained popularity and status with little criticism. As stated previously, it remains the most popular therapy method, and because of this, it is continuously highly regarded. CBT has received little criticism because it is highly evidenced to work on the majority of clients, regardless of their problems. With many third wave approaches becoming supported, CBT will need to conform to this emerging science in order to retain its strong foothold in psychotherapy. Thank you for watching. I hope you learned something new about CBT.